And you know that we can use also the teeth from the market, the conventional teeth, and we can loot the conventional teeth to the base. Anyway, it's quite difficult to treat all of the patient with this protocol because sometimes we don't have so much space in the interarch distance. So to mill or to print teeth, I think is the best choice, because we can individualize our teeth, and the cervical part of the teeth are positioned properly to the base. So we can maintain the occlusal plane. We don't have a lot of occlusal problem also if we use an evolution or white and pink disc, or in this case, the oversized process. Here you can see the prosthesis at delivery, and the patient was really happy about his prosthesis,